instructor know that I've provided privacy by closing the curtains and I've washed my hands before coming into the room. And I will be assessing you from the top of your head to your toes, back and front. Do you have any problems with me assessing you at this time?
No problems.
Okay. And I'm also going to be taking your vital signs. Is that okay?
That's all right.
All right. And before I start, are you having any pain? Our pain scales vary from 0 to 10 via Gurnett College.
No pains.
No pains. Okay, good. Okay. And can you state your age?
23.
Do you know where you are?
The hospital.
Do you know who the President of the United States is?
Donald Trump.
And do you know what season we're in?
Spring.
Okay. And then I would let my instructor know that my patient is alert and oriented ×4. And I'll be looking around the room, looking for lines or tubes. The patient has no IVs, no NG tube. There's no tubes around anywhere in the room. So I would let my instructor know that I've checked the room and my equipment is ready to go. So prior to starting, I would make sure that my bed is raised to a working level. Make sure the light in the room is appropriate. I've already pulled the curtain for privacy. I've done my hand hygiene and I have my gloves on. And then I would ask for your name and date of birth again. Can I get your name, please, and your date of birth?
Danny Tafaga, 03/06/1996.
Okay, so I have confirmed that I have the right patient. So I would be checking your vital signs, which is your temperature, your heart rate, your blood pressure, and your respiratory rate. Are you having any pains at the moment?
No.
Okay. And I've already asked you for the date, if you know where you were. So my patient is alert and oriented. So I'm going to be checking your head. I'm going to be checking your head for any bugs or any sores that I might see. Right? No, and everything looks good. I'm also going to be checking behind your ears and inside your ears with my pen light. And I'm going to be looking for drainage, any type of drainage that might be inside your ear. If you can look this way for me. Okay. And I'm going to whisper something to you to make sure your hearing's okay. Just say it out loud when you hear it.
I like chocolate.
You have to say it out loud. Okay.
I like chocolate.
That was good. That's good. Okay. Okay, now I'm going to check. I'm going to check your eyes. Can you close your eyes? Open your eyes. Okay, looks good. I'm going to check Oh my goodness. Okay.
Just keep going. Keep going.
I'm going to check your pupils to see if they constrict.
Oh my God. It's okay. It's okay. Just keep going.
Is it a...
Come on.
Okay. Okay, looks good. And I'm also going to be checking your muscle movements. So don't move your head, just move your eyes and follow the pen light. You ready? Okay, everything looks good. And now I'm going to be checking your nose. I'm going to be checking for any drainage. And I'm also going to be looking at your deviated septum. If it's near the other side more than the other, you can have difficulty breathing. And now I'm going to be checking your mouth. Can you say ah?
Ah.
Okay, and I'm checking for any receding gums, bleeding gums, any redness, any swelling. That's good. Okay, and now I'm going to be looking at your neck, and I'm going to feel your neck, but I'm going to be careful not to massage the carotid artery so you don't pass out. And I'm going to ask you, can you look to the left and look to the right? And can you lift your head off of the pillow? Okay, good. So nothing wrong there. And do you have any pains within your shoulders or your arms? Right, good. And can you lift your arms? can you put them back down? And can you move your fingers for me? I'm gonna check your cap refills on your fingers. Comes back almost instantly, good sign. All right, and I'm gonna be doing the heart assessment. Okay. So when listening to 1, 2, and 4, I would use the bell of my stethoscope. And with the mitral, I would listen to the apical pulse and for a whole minute. And let me grab my watch because I totally forgot. Where? Oh, I found it. So here's my watch. And let me take my stethoscope off. And I would be listening to the mitral area for 1 minute. So let me just, I'll start my minute there. Also, when assessing the heart, you would start from the aortic to the pulmonic to the tricuspid to the mitral. So I have a couple seconds to go. Okay. All right. And now I'm going to assess your chest to see if your breathing is normal. Okay, I'm going to ask you to take a deep breath for me, okay? Take a deep breath. Okay. And I compared each side of your lungs. And then I'm going to have you sit up for me so I can check the back side of your lungs. And then usually we would remove the clothing or go under the clothing of the patient, but right now it's not too necessary. So go ahead and take a deep breath for me. And I'm listening for any wheezing or crackles. Take a deep breath. Okay. Go ahead and lay back down. And now I'll be assessing your abdomen. So first I'm gonna look at your abdomen. And then I'm gonna listen. And then I will feel. So when I'm looking here, I'm looking if there's any masses or discoloration of the skin. And I'm gonna listen from the right lower quadrant up to the right upper, to the left upper, to the lower left. And have you been vomiting?
No.
Any issues going to the bathroom?
No.
And when was your last bowel movement?
2 hours ago.
Was it normal?
It was normal.
Okay. And how was the consistency? Was it hard? Was it soft?
It was pretty solid.
Okay, good. And do you have any pain or discomfort when you're urinating?
No.
Is there any blood in your urine?
No.
Do you have a nasty odor to your urine? And when's the last time you ate?
About 3 hours ago.
Okay. And do you have any problems while you're eating?
No.
Okay. All right, so I'm going to move down to your legs. Okay, and then just see if you can move them appropriately. Okay, And then I'm gonna feel your popliteal pulse behind your knee, and I'm gonna do it once at a time. Feel that one, checking the pulse here. Then I'm gonna check your other popliteal pulse on the other knee. Okay, and then I'll be checking the top of your feet. I'm gonna check the inside of your ankle bones and make sure they're both equal. Sorry, I'm just gonna take your socks off for a little bit.
Cold.
I'm gonna be checking the inside of the ankle bones, making sure they're equal, looking for any swelling, checking the color of your legs. And then I'm gonna assess the bottom of your feet for your cap refill. Oh, sorry. Just seeing if your cap refill is good. Comes back.
Tickles.
Okay, so I'm gonna push back against your feet and just see if it's okay. Okay. And then if I can have you lay on your stomach for me. So here I'm just also checking the back of your body, looking at your skin, looking at the color, making sure there's no pressure ulcer. And then you would spread the buttocks, look for no redness, no discharge, and no odor. No swelling. Right, and then you can turn back over. Make sure there's no redness in your buttocks area. And then when you're all finished, you put the bed back in a low position. Make sure patient has access to their call light. Place my bed rails back up, and I will document and report any abnormal findings or normal findings that I have found.